Hey everyone, welcome back to all my listeners. Hope you're all having a great day so far. And if it's your first time finding me, thanks so much and welcome. Welcome to episode 17 of my 4th season. Today is Wednesday, December 22nd, 2021. My name is Sonal Patel, and this is the Paint the Medical Picture podcast series. Now, can you believe it? We're just 2 days away from Christmas Eve. I know I have so much to be thankful for. I just got my Moderna booster at last. Finally, my 6-month point, and they took me in. They turned me away when I tried last month, so too soon, they said. Too soon. Now, I was wiped out this weekend, so I'm glad I got it on a Friday because I was wiped out for both Saturday and Sunday. Wow, it was a doozy. But anyway, I'm happy I'm boosted. I'm happy I can do my small part. Now, in my compliance tip today, I dive into a new series and I want to bring us back to basics. It's important to know who are the RACs. And I roll out the red carpet, pop the champagne for my very special newsworthy guest, Jeanmarie Loria. Oh, and by the way, I'm still fangirling since I just met Jeanmarie in person at the NAMUS conference in Florida. And I go ahead and round out today's episode with a remarkable quote on illumination from the legendary Oprah Winfrey. If you've checked me out on LinkedIn, you know I'm all about compliance and protecting our physicians and valued healthcare professionals when it comes to the business of medicine. I hope this week with me brings you enough to take back to your organizations, to want to dive in deeper, to use my tips and best practices to ensure success. I hope this podcast will help you boost the quality of documentation capture and improve coding accuracy as you help your providers paint the medical picture. If you like what you're hearing, please go ahead and hit that subscribe button now so you don't miss another episode. Please write in a review and kindly drop me a 5-star rating on Apple Podcasts or wherever you listen to my podcast. I'd really love your support. And as always, a friendly disclaimer. Remember, I am bringing you the news, current healthcare industry news, my compliance tips and recommendations based on my over 10 years of experience in front office, back end, coding, and billing for multi-specialty physicians, compliance, and auditing for both E&M and surgical operative reports. These are my opinions alone and are not to be construed as legal advice. So let's get into a very special newsworthy that features my guest today, Jeanmarie Loria. I'm so excited to introduce her to all of you. Now, Jeanmarie is the managing director at Advize Health. She provides quality consulting and project management services that accelerate her clients' ROI and satisfaction. Previously, she was a senior associate with KPMG's North Florida advisory practice with 7 years of financial analysis and IT experience. Now, prior to KPMG, while working for a municipally owned public utility provider in Orlando, she created a web design service and an iPad application business, which focused on safeguarding customer data. As a skilled project manager, Jeanmarie has the acute ability to focus on data flow and business applications by interviewing companies to develop an organized process overview, drilling into areas of potential weakness, and then building plans to mitigate risk. She's coordinated and executed testing efforts surrounding the healthcare and utility industries to deliver process improvement and integration with data mapping, policy and procedure design and development, as well as organizational analysis and alignment. Jeanmarie has performed integrated IT audit testing and reviews specific to healthcare, utility, and insurance organizations to analyze business processes and assess the effectiveness of controls surrounding key financial modules, general IT controls, and interfaces. Now, finally, Jeanmarie has an MBA with a concentration in finance, as well as her additional certifications, including project management, professional, Six Sigma Green Belt, and conflict resolution mediator. Oh my goodness, Jeanmarie. That is an incredible, incredible bio that I just read to my audience. I am so honored to have you here with us today.
I'm
Welcome.
blushing. Thank you. Thank you, Sonal. It's so sweet. Thank you. Thank you very much.
Oh, I love it. I love having you here. Now, you know what? That bio, presents a lot of your previous and obviously current expertise in the IT space as well, right? All of those particular skills can translate over into healthcare. And then that bonus of your business skills with that MBA, right? I think this is a must for coders who are interested in developing their own outside of the box thinking and perhaps one day creating their own businesses, right? So, when you go off and talk to people in hospitals, you have direct access to folks in the C-suite. And I believe that MBA gets you in the door, but I also think that CPC credential that you do hold helps as well. So I think I'd really love to know some more about your journey. What types of steps did you take to sort of climb to where you are today?
I appreciate that, Sonal. It's a great, great question. So thank you very much. I remember early on in my career when I was still an intern. So I interned everywhere possible while I was getting my MBA. I did my MBA directly after school. I remember speaking to one of my bosses at the time, and I said, how would I know if this is right for me? Because my first job that I accepted right after, actually, well, I was still getting my MBA, but my first real job I felt was so beyond what I could do. And I remember specifically, he said to me, if you're not comfortable, that means you're doing the right job. So get out of your comfort zone and oh, you're always prepping for the role next. So get ready for whatever that is. Be ready for the next promotion, be ready for the next gig, the next company, and just be out of your comfort zone all the time. So I will tell you, not necessarily fake it till you make it, but sometimes I've noticed, I hate to go like gender on this, but I have noticed and I've read studies about how sometimes men versus women when looking at a job, an open job, how sometimes different people, I think this is maybe more of a personality thing than anything else, will look at, say, 20 points of the job and say, oh, I only fit 3, I can't apply for this. And then they won't apply versus other people say, hey, I fit 3, I'm going to apply and see what happens. And I think that that's a personality trait. I grew up, as you can hear by this voice, I grew up very, very New York. And I come from a family that's like, get out there and do it and try it and be the best that you can be at whatever it is you're doing. And if you fail, it's fine. We're here for you anyway. So with my different roles that I've taken throughout my career, I've always just tried to expand a little bit beyond like what I've done before and see if I can help make things better, better for my team, better for clients, better internally, externally. I haven't always gone after the things that I like best. In undergrad, I went computer science. I didn't like anything about programming at all. I didn't really like technology. I didn't get a computer until I was well into my teens. And I didn't even know how to use a computer. And I was going to be a computer science major, which is wild, but I didn't want to quit. And once I got in there, I said, I'll try this anyway. I'll keep going with it. And I've always tried to see, like, okay, what part of it can I excel at? And what I realized was that everybody around me, they were great programmers and great technology brain thinkers, but I had more of the soft skills.
Mm,
So I figured maybe
right.
I could manage computer programmers, but not necessarily be one. But in order to do that with any kind of quality, I should at least go through the program and understand enough to be dangerous, which is, believe it or not, while I went through my coding piece of this, how I was able to help in the space that I'm in now. So I always felt like, what can I take out of something? Don't be a quitter and bring the best that I have to the next thing. So I would say that that has been true of my entire career. Um, I would also say that I've never just stayed in one thing. So I started out in computer science. I got my MBA in finance. I went into different finance roles, which have nothing to do with like the very next role that I did, which was IT audit. And I was doing strictly IT, but What I will say is that the finance background helped me with personal finances at home. And then when I got into the role that I've been in for the last decade, which is in healthcare, where I'm in now, I've used the finance background, I've used the IT background. So I've been able to really leverage it. So it's a matter of being smart. When I mentor younger folks getting started in their career or students, I often have this discussion with them like, okay, what you're learning now, yes, the certification is hard. Yes, what you're doing in school is hard, but you'll be able to apply it. Don't let it lapse, continue to have that because it could really benefit you later on. Don't make any rash decisions thinking like, I don't want to do this. See what it has, because oftentimes of what you end up doing in your career is nothing to do with what you did in school or for that particular certification, because you could get into one area that you really like.
My goodness, that all of your talking points right there are incredible. I don't even know where to start from. But what I'm hearing is that, along the way, you've had a lot of people in your life push you, and you did not back off. You embraced it, right? You said, yeah, I'm not going to be scared of anything. I'm going to push through it. I'm going to continue moving forward. Take all of those skills, right? I mean, your parents encouraged you, your mentor encouraged you. That's incredible. So I think my audience can take away a lot from those particular talking points. And I think what brings you so much strength to be a business owner in your own right is, I think, people who have worked in those big four consulting companies like you did at KPMG. I think there's so much skill sets that you learn at those types of companies that you can really take away, right? And move forward on your own with. Those skills are incredible, incredible. And I'm also hearing that you do have a lot of soft skills, which, as we know, is so important in today's business world, right? Those are skills that weren't always talked about or valued in the business landscape of the past. But those types of things are really, really strong and complement CEOs like yourself today. So I think that's incredible, incredible. And I think you're absolutely right that that IT auditing skill set that you possessed early on, you're still doing that today as well. And I'd like to hear some more about that in a little bit when we talk about what the differences are between, auditing for the IT space versus auditing for healthcare, right? A lot of similarities because of big data that exists and it's just getting bigger and bigger. But that's amazing. I love some of those steps you took in your journey. That's incredible. That's incredible.
Thank you. Thank you. I've been very fortunate, honestly. I've been fortunate.
I love it. I love it, Jeanmarie. All right. Now, you know what? Let me move on to my next question. It's along that same vein, though, right? About your past and your history. So if you can, I'd hope you could share some more things that could help my audience, because we're all curious. Why did you get that CPC to begin with? And then if you could share some more about your inspiration to starting Advize Health LLC, like what was that inspiration about?
Thank you. I would love to say like, oh, I grew up wanting to own my own company. I
Right.
absolutely did not.
Right.
I don't really know that I knew what I wanted to do, right? Growing up,
Mhm.
even in college, I wasn't necessarily sure. I only knew what I knew. My mother was a nurse. My father was a cop. I
Okay.
knew people service. I knew,
Okay.
trying to help others. And then
Mhm.
when you turn around and see like me being in business, my parents would be like, why couldn't you just go help people? What do you mean you're in business? Like, what
Right.
does that really look like? So what I'll say about that is that I've organically looked at what are my strengths and can I build on my strength, my internal innate default strengths. When
Mhm.
I am at my most tired, what do I still do even remotely well? And that's like where I've gotten to. So I was doing IT audit. I was loving my life at KPMG, and this opportunity came up for me to come in and get involved with a medical record auditing firm. And I said, well, that's really cool. Like, it would be nice to specialize. At that point, I had been focusing on IT audit at hospitals. I said, this would be an interesting segue into something a little bit different. It was an opportunity to be very involved with a particular practice and get some management, like additional management time under my belt. So I was excited about that. I did not know. So day one that I started this role, I did not know the difference of a payer or a provider. So I remember I went to a happy hour after my first day and somebody said to me, who pays you for the audit? Is it the payer or the provider? I said, I don't know. I'll get back to you on that. And meanwhile, I'm there managing a team of this is what they do. So I started sitting down with my team of auditors and saying like, okay, what do we do? Like, what do we really, why do we do this? And I was very fortunate to have a team that could explain to me the nuances of audit in this space. And as they were explaining it, I was really trying hard to understand like, okay, if we're doing audits for payers, why would they hire us to do those audits? Of something that I learned in business school was getting my MBA was that, you could have a great idea, but if people aren't paying for it, then you don't really have a business. If you can't describe the solution that you're providing where somebody could write it on the back of a napkin, you might really not have a business, so, and because that also helps you when you're thinking about your business, like, yes, this could be a solution today, but will it be a solution tomorrow? And you always have to think about barrier to entry, other competitors, and all of those things. So as I got into this, I started my job not understanding really what my practice did. I knew that I had good auditors, people really cared about their job. I knew that we had great clients, but I didn't really know like why we did what we did. So I kept saying like, why do people hire us for these audits, and really understanding. And I drank from a fire hose. I'll tell you, every day I used every component of my business background. Every single day I was doing marketing stuff, I was doing sales stuff, I was doing stuff that I never learned that I would just try and say like, could this work? And I made a lot of mistakes and I failed in a lot of ways, but I always said like, what could I learn from that? So I was managing my team of auditors and I kept realizing that I could not appreciate enough of what they were doing. I would hear picks, I'd hear DME, I'd hear all these acronyms, and I kind of understood, but not enough. So I said to my team, I said, okay, listen, I really want to get my CPC. Everybody has a CPC. I only hire people with at least 10 years of audit knowledge, not even coding, but audit knowledge. I need to do something to bridge the gap. I understand me sitting for the CPC would never put me remotely close to even a CPCA who's been doing it for a while. I understand that, but I want to at least understand your knowledge or your background. So I told my team, I said, it's hard for me to be able to sit down and study for this. I want a boot camp. And I said, like, I took my PMP, my project management professional, with a boot camp first. I wanted a CPC boot camp. So my team developed it, right? I had incredible CPC trainers. I had incredible educators. So we developed this boot camp, and one of my employees and I, we were the first two to take it with some other people. And for 1 week, I studied the books. I practiced. I think my first exam was a 68. And I said, oh no, because I had to truly write in my books, like all of the terms that I didn't know. And I'm talking like easy terms. I wasn't familiar with anatomy, physiology to the point where I really should have been. So I took it again and I got a 69. And then I was like, I'm done with this. I'm not taking it again. I feel like I have it. My mom was like, you're not a quitter. Take it one more time. And then I passed. And I was very, very happy. And I felt like that was the hardest certification that I worked on. Absolutely the hardest. It didn't come natural to me. Frankly, I didn't really like parts of it. Like the chapter on the eyes, I couldn't even look at those pictures. I was like, that is disgusting. The heart, cabbage, like I didn't understand. Like I just really didn't understand. I remember getting to the car telling my mom, bilateral oophorectomy. I don't know what that was. And I kept looking it up. And my mom was like, how stupid could you be? That's easy. Why didn't you know that? And I was just like, it's hard. So for me, when studying for the CPC, it gave me a taste enough, not to say I know better than any of my auditors. I will always, when I'm on the phone with my team internally, when I'm on the phone externally, I will always say, I really have to bring a subject matter expert on the call with me. I know just enough to, if I hear something that's inpatient versus outpatient, I know just enough and I could understand just enough to know who I need to tap or when I'm interviewing somebody. And that's really where the CPC helped me quite a bit. And I will tell you, so when it came to the company and how Advize happened, I was in that firm working for them, and I got wind that they were selling every practice except for mine. So I got really nervous and I said, I hired all these people to work for me. I had a lot of single moms, so different auditors working for me, and didn't want them to lose their job. So I went into my boss and I said to him, I love what I'm doing. This has been a great learning opportunity. At that point, I had been there for just under 2 years. And I said, I really, really like this space. I think what we're doing is super cool. We're helping catch the bad stuff, whether it's payer provider side. I like what we're doing. I just don't know when it'll financially turn around. We were losing a lot of money every month. And I said to him, I just really want to be able to buy this company and see what we can do and what we could really help. And so he said, great idea. The company, you can buy it. Sure. So in January 1st, 2015, I bought the company. We rebranded to Advize Health. And in that whole evaluation process, I can tell you, it was a lot at home. It was a lot professionally, because, do I really want to fall on my face? Do I if I'm doing making payroll for everybody, do I want to believe in myself enough to say that 30 other people, I'll be able to make their paycheck? And it was something that I just felt we really had to do. I felt so strongly about our clients and my staff. I thought we could do it together. And I had to go home and say, are we okay with me not making a paycheck? Because in order to have your own company, you really have to be okay with the idea of, if things go wrong, how long do you have? Do you want to compromise anything? So does that mean time? Do you want to compromise never having a vacation? Do you want to compromise quality? If you can't afford it, are you okay with doing less quality? Like, something has to give. And so it was a big decision. And if I didn't have good people in my personal life to support me, and great people at my company professionally to support me, I would not be sitting here today. So this really isn't about me. It's about my team. And I have such a great army of people behind me able to help. The final thing that I'll say is, again, not really thinking like, oh, I want to start this company where we do XYZ. I organically picked up a company that was already in operation for a solid 12 years. So for me, we were already in a place. What we tried really hard, my team and I, to do was listen to what all of our clients were saying, observe what they were doing. So sometimes, you have your clients say one thing, but really do something else. Observe that. Try to learn from the market, truly learn from the market as to what was necessary, and then shift ourselves into a place where maybe nobody else was, or maybe that our competition was afraid of going after. And we put ourselves there to say, like, okay, how can we help? What can we do to help our clients and help the industry and help healthcare? We're not afraid to say yes, and we're not afraid to fail. So that's how we organically grew what we do today.
Just incredible. I just feel smarter listening to you talk. I mean, you have shared so many honest comments about how you got here and why you got here and what you want to do. It's incredible. It's incredible, the business acumen that you've just displayed right now in these few moments with all of us. It's just remarkable. It's remarkable. I mean, the clarity that people can take away from this is that, being a business owner, like you said very honestly, is difficult. And you actually do think about your entire team. And you didn't want to let anybody go, right? You had some single moms on your team that you were like, no, I don't want to, have to send them a pink slip for any reason. So there's so much deeper meaning behind what you do and the thought process, right? And what motivates you to do what you do. So it's incredible that you've shared all of this information, because I'm hoping it can help a lot of people who are, wondering, waffling, teetering on the fence. if this is something that they would like to start on their own. And
Nothing's
as
wrong with just
and,
getting out there and trying it
and
and
getting
saying,
right,
like, I have to know that I tried, because if you just
exactly.
continue to go through it, and I've helped different coding and auditing professionals say, like, okay, do I want to have my own company? I had one woman that I really, really wanted to hire, and she said, well, I'm not sure if I want to do it on my own. I said to her, please let me be a resource to you. These are my favorite magazines. This is what I do as resources. Use me as a peer, use me as a mentor, use me as an intern. How can I
Right,
help you? Because I
right.
think that it's so important for each individual to never leave anything on the table when they are ready to retire or be
Mhm.
done with this career. Say, like, I really wish I would have tried. I think you just
Exactly.
gotta, like, get out there, fail, and say, you know what, I did it, and now I'm on to the next thing. But sometimes you succeed.
Exactly. You know what? And that's so well said. That's exactly how you and I met. I don't know, on LinkedIn, where I meet everybody, is on LinkedIn over a year ago, right? And I was so happy to have seen you at our last conference together just a week ago, just a few days ago at NAMUS, and meeting you in person for the first time is like this conversation. It's inspiring, right? And I, like you, try and network and mentor and guide new coders and compliance professionals because that's what I do. So I like to also encourage them to see what their next steps are. What are they thinking about? Why do they want to leave their current job? Or what are they looking for to start a career as a coder or as a biller? So yeah, I think we share that commonality. But in terms of being a business owner, I can guide people towards you because just hearing you talk here today is incredible. All of your insights, all the toughness, but you have to have that wherewithal, right? You have to just push through and do it because, like you said, we only live once, right? Like, what are we waiting for? Don't wait until it's too late. Don't live your life with any sense of regret. I totally love it. Jeanmarie, amazing, amazing. Wow. All right. Now, you know what? Let's move on to my next question. Now, I'm all about working smarter for coding compliance and affecting change in this particular space of healthcare. But I want to keep hearing your voice. I want to know, what is it, in your opinion, that makes Advize Health stand out? How are you and your company providing compliance initiatives for your clients? And I'd also love to hear your thoughts. I'd love to know more about your drive and what fuels you to be a top female small business owner in Florida today.
Thank you. Thank you. I'll do the best that I can with it. That's such a good, that's really, really a great question. So I appreciate it very much. Thank you. So first of all, again, I never wanted to be a small business. I never wanted to be a business owner. What fuels me is I love that as a company, Advize Health, we're able to react to things that we hear. We hear, hey, we would really like a training on XYZ. Well, a week later, we might be able to produce iteration one of XYZ. I don't have to take that to a leadership team that would say, like, no, what's the justification? Like, we're always like, hey, let's try it a little bit. It might not be the best perfect one, but let's try it and see. And I think that our clients over the years have known that they can come to us and truly get a sense of that. Like, I've had clients call me like, hey, listen, I need a person to be one of my auditors just for a month. And if it works out, we'll talk about long term. And we're not afraid to say yes to it because we're accountable to ourselves. We talk to somebody like, hey, you want to do that? Okay, we want you to do that. Sounds good. Sounds good. See what happens with the client. Then we're always looking like, is there a modification? We're big yogis at Advize. So there's always somewhere to go when you're doing yoga. There's always some type of modification. For us, every single client delivery, every single project, we're looking for, with our clients, feedback. We're looking from our employees, feedback. Tell us anything you think could be done better. So first, I will tell you that what we're really into is healthcare doing the right thing. When I got into this company, we had only been doing audits for payers. What I really wanted to do was help proactively the providers. And I remember I had a client say to me, well, what side are you on? Who are you trying to get the money for? I said, I would like to sit on the fence only with CMS and not do a provider focused audit or a payer focused audit, but more so, this is an accurate and true. If CMS was to come in here and look at you, this is exactly what your findings would be. For me, and you said this earlier about the similarities of auditing from an IT perspective versus like a CPC perspective, there is a right and wrong. There is I used this guidance to come up with that answer. And that's really what we do as auditors. One thing that I learned at KPMG was completeness and accuracy. So doing one type of audit for accuracy doesn't imply completeness. So it could be, does the documentation support a 99215? But then it's another conversation of, did the document look like there could be potentially fraud, because this document might mean that everything is 99215. You need to look at more data. So for us, we've always tried to deliver an audit that's completeness and accuracy. So we are delivering everything that the client could want. We're always looking for other things to add value, not like, did we do enough that the client will pay us and we can move on to the next project, but really, is there anything else? Abject client satisfaction. That has always been an internal tenet that we just truly think about every single day. And then on top of that, I will tell you, one of the hardest questions I've ever gotten was, what's more important, your client happiness or your employee happiness? And it's impossible. That's chicken and egg. If your employees are not happy, they will not deliver to make your clients happy. So we offer a certain level of autonomy internally where our staff knows their clients better than I know their clients. They know auditing better than I know auditing. What I am here to do is support them to be the best that they can be. And so Advize, thankfully, knock on wood, we're able to develop different solutions that the market needs, that they're asking for based on consulting best practices. So we've brought in that. And then also that we're able to always do the right thing for quality. I will tell you, I had a project this year where one of my staff did not do a good job. Client told me, like, I'm unhappy. I haven't gotten any value out of Advize. Advize did 100% credit and said, how can we do better? Is there anything else we could do? We're sorry we didn't realize this sooner. It did not come to our attention sooner. And that's what needs to be done. If you go to a restaurant and you're not happy, it's not give us credit on the next meal. Correct that current meal. Bring out the dessert. Bring out a glass of anisette. Like, you do what's required to make the client happy. So we've always been able to do that, because I don't have to bring that to somebody else to say, please, can we do this? The client's a really important client. We know it, and we go out there and do it. The final thing that I think has really made us different. So not only this big four, learn from a good consulting firm, distill it down to healthcare, we also had access to retired HHS OIG agents in a way that I haven't seen many of our competition doing it. So one of my clients in New Jersey, Horizon Blue Cross Blue Shield, has been an Advize situation for a long time. SIU manager there said to me, I need for you to meet somebody that is a friend of mine here in Jersey, whatever. And he also knew one of my very dear friends, Karen Weintraub. So Megan McCarthy, Karen Weintraub tells me, oh, you have to meet this guy. I said, first of all, I don't deal with government. I'm not in Jersey that much. I'm a New Yorker. Like, I come in for great Portuguese food, but I'm out. And they said, I got to meet him. I met him, and this ended up becoming my person. So person that I share a pillow with, pillow buddy, whatever you want to call it. This ended up becoming my person. And I was able to collaborate with him. I said, like, hey, look, what really bothers me about healthcare is the cost of healthcare. That's all I want to talk about. And I was able to have lunch with him, and I said, you're an OIG, HHS OIG agent. Tell me about the work plan. My clients love the work plan. Tell me about the work plan. And he said to me, well, I hate to spoil it for you, but nobody uses that. And I was just like, don't even say that to me. You don't get your cases off of the work plan. And so it gave me a sense of how things work for the OIG and what he was saying, because if you know Eric Rubenstein, he loves to give you your quick jokes and your quick hits here and there. What he was really saying to me was that sometimes you have to look at fraud from a different lens. When you're looking at drilling into the data for audits, it's not necessarily what's on the work plan alone. Sometimes it's nuanced things that are really specific that aren't necessarily there, or maybe sometimes the data analytics is a little bit old. So what's falling out of the analytics is old. You have to look at things in a different way. I really loved having the opportunity to collaborate with him many times. We would sit down for dinner and I would say, well, at the cost of healthcare, this is what I want to do. I want an Uber for people when they don't understand their bill, get in touch with a CPC, and there is now the Uber of healthcare. And he would say, well, when CMS did skin in the game, and he would always give me this different devil's advocate. And we were lucky enough to bring him onto the Advize team and bring his friends who are tremendous, tremendous retired agents where they are looking at fraud from a different lens. So one of the areas that we've shifted as Advize, not only to do the traditional audits that we've always done, is to also do investigations. And we're able to collaborate with great investigators and the audit, and that brings again that completeness and accuracy to bring it more into just like conversation on compliance, and the clients love it both on the payer side and the provider side. It's just generating value. So at the end of the day, we come back to, are we generating the most value that we can? But I'll say, not having the deep pockets of a bigger company, we wouldn't have been able to attract the talent of Eric Rubenstein if we didn't have this developing relationship of let's collaborate, innovate together, and do things the way that his heart was in it versus can we pay him a big paycheck and get him in here? It was more so he wanted to be part of this team, and then that attracted more like Eric Rubenstein. So we've been very, very lucky.
Just amazing, Jeanmarie. I mean, your collaboration with him, the two of you are a powerhouse in this industry, right? I mean, he's ex-OIG, and this is an amazing blend, and it definitely does set you apart. It's a unique business model. I love it. Loved hearing all of the nitty-gritty. Wow.
Thank you.
Simply incredible. I love it. I love this. And now can you, I don't think we mentioned, where is Advize Health located?
Oh, thank you very much. We are headquartered in Orlando. We
Okay.
do a lot of work East Coast and West Coast, but we've been growing the middle states. We have quite a footprint in DC, Baltimore, New York, Boston. But we've been recently getting into more of like a Nebraska, Minnesota, and middle states. So that's kind of nice because I love the food in the central states.
You're a foodie. I love it. I love it. That's amazing. Well, you know what? I think with our combined audience, there is room for all of us to share and collaborate, right? There's so much going on in the healthcare landscape currently and definitely in the future. I think you and I have a good idea of what's going to happen in 2022 in terms of it's going to be another year of the audits, right? Since everything has been unleashed, this tsunami is just going to continue flowing towards all of us in this particular space. And I can hear from your voice, your passion. It's all about helping, right? Do the right thing with accuracy and comprehensiveness. So I love hearing that that's what Advize focuses on. And I love that your whole KPMG background helps you solidify that also. So amazing and unique. Advize Health LLC in Orlando, Florida. Love it. Love it, Jeanmarie. Now, you know what? I know we have to go, but in my last question, you know what? I'm still interested to hear, where are you going to be in the next 5 years?
Thank you. So I don't know where I'll be in the world because I love to travel and I could end up anywhere. I'm always saying I'm interviewing other countries. I have no idea, but I love to be a student of the universe and just learn and see different cultures. So that's a geographic location. In terms of Advize, We really, really want to reduce the cost of healthcare. At the end of the day, we could charge more, but we don't. And we always tell our clients it's so that you could pass on the savings. At the end of the day, we care. And I said at the end of the day a lot because the truth is, this is all that matters to us. We really, really want people to be able to receive healthcare at a reduced cost. It should not be costing because it always costs somebody. I always present my insurance paid for it. Why should I care? The truth is, it ends up costing the system. We want to be the part that helps reduce that cost. So we want to help payers, we want to help providers, we want to help auditors, we want to help nurses, investigators, we want to help everybody be part of that conversation. And that in turn helps the members and the patients receive the care that they need and not have to determine, should I pay for my rent or should I go receive this medical care? Should I get this MRI or should I put food on the table? That's the only thing we care about. And that's truly the only piece of this conversation that I would love to leave everybody with. We're all empowered to help. And if I could help anybody be part of that conversation, I really want people to feel free to call me, text me. My number is 407-583-7379. Email me, jloria@advizehealth.com, advise with a Z. And that's it. I just want to be a small blip, and it doesn't have to be my name ascribed with it. It really just, I want to help that piece of it, and then I know I will die happy.
Oh, I love it, Jeanmarie. I know you're going to make this happen in the next 5 years and beyond. I love it. And thank you for sharing your contact information with my audience. I'm going to make sure I put it in my show notes so everybody has easy access to it.
If it's an introduction, if it's a review of a
Yes.
resume, if it's advice, and
Great.
it's not that I know best. I could just tell you and share with you things that I've done that have failed, things that I've done that have worked, and I really would love to help people. So however.
I love it. Yeah. And I've known you long enough that I know you are interested in helping others. So absolutely. If people come here to my podcast seeking your advice, I'll definitely send them your way. Absolutely.
Thank you for
Aw.
all that you do, Sonal. Thank
Oh,
you.
it's my pleasure. I'm so glad that you were on with me today, and I'd love to have you back in the future. So thank you so much.
Thank you.
And now it's time for my best practice tips in Trusty Tip. So in today's new Back to Basics compliance tip, I wanted to answer your number one question to me. Who are the RACs? So, per the usual, the US healthcare industry is full of acronyms. My head is full of them, and it's often just second nature to remember so many. But then you may often miss the long version of many others, right? I know I do. So, again, who are the RACs? Well, they are Medicare's Recovery Audit Contractors, the RACs. Now, the RAC program was created and is still overseen by the Centers for Medicare and Medicaid Services, that's our CMS, to support their program integrity efforts. And according to the RAC's mission, their main purpose is to, quote, identify and correct Medicare improper payments through the efficient detection and collection of overpayments made on claims of healthcare services provided to Medicare beneficiaries, as well as the identification of underpayments to providers so that the CMS can implement actions that will prevent future improper payments in all 50 states, end quote. Now, there are currently 5 RACs across the country. There is one in each region. There are 5 regions, regions 1 through 5. However, there's one RAC for the nation that focuses only on durable medical equipment, prosthetics, orthotics, and supplies, or DME-POS, as well as home health and hospice services. This is the region number 5 RAC. Now, this region number 5 recovery audit contractor is through Performant Recovery. So let's move on to region number 1. The region number 1 RAC serves the states of Connecticut, Indiana, Kentucky, Massachusetts, Maine, Michigan, New Hampshire, New York, Ohio, Rhode Island, and Vermont. Now, this region number 1 recovery audit contractor is through Cotiviti. Now let's move on to region number 2. The region number 2 rack serves the states of Arkansas, Colorado, Iowa, Illinois, Kansas, Louisiana, Missouri, Minnesota, Mississippi, Nebraska, New Mexico, Oklahoma, Texas, and Wisconsin. Now, this region number 2 recovery audit contractor is also through Cotiviti. Let's move on to region number 3. The region number 3 rack serves the states of Alabama and Florida, Georgia, North Carolina, South Carolina, Tennessee, Virginia, West Virginia, Puerto Rico, and the U.S. Virgin Islands. Now, this region number 3 recovery audit contractor is also once again through Cotiviti. Let's move on to region number 4. The region number 4 rack serves the states of Arkansas, Arizona, California, the District of Columbia, Delaware, Hawaii, Idaho, Maryland, Montana, North Dakota, New Jersey, Nevada, Oregon, Pennsylvania, South Dakota, Utah, Washington State, Wyoming, Guam, the American Samoa, and the Northern Marianas. Now, this region number 4 recovery audit contractor used to be with HMS Federal Services, but it's just been taken over by, guess who? Cotiviti GOV Services. Now, let's move on. What does a recovery audit contractor do? What is the RAC all about? Well, RACs review claims on a post-payment basis. The RACs detect and correct past improper payments so that CMS and other carriers and their MACs can implement actions that will prevent future improper payments. So you might be wondering, what types of topics do RACs review? Well, I recommend you should stay in the know and look at the CMS websites often, because this is where proposed and approved topics that RACs are able to review can be found. These topics will be updated monthly on the RAC Reviews topic page and include such things as the name of the review topic, as well as the description of what's being reviewed, as well as the states or the MAC regions where these reviews will occur, as well as the review types. Will it be a complex review or an automated review? They'll also discuss provider types and affected codes, and they'll even discuss applicable policy references. Now, some breaking news here. There are 2 brand new RAC topics for DME physician and DME supplier that just got approved on December 7th, 2021, just a few weeks ago, for enteral and parenteral nutrition therapy with dates of service on and after September 5th, 2021. And they want to look at medical necessity and documentation requirements. Both of these brand new hot topics are for complex reviews. Now, what types of reviews can RACs conduct? As I just mentioned, one of them is definitely complex. The other is for automated. Now, automated reviews occur when a RAC makes a claim determination at the system level without a human review of the medical record. And then complex reviews occur when a RAC makes a claim determination utilizing human review of the medical record or other required documentation. And then finally, let's talk about your burning question. Can I appeal a RAC finding? Absolutely. Providers are given appeal rights for Medicare overpayments and underpayments, which are determined during the RAC review process. Now, my best practice recommendations are always to get yourself familiar and network with educated consultants and get to know the many great seasoned healthcare attorneys that are out there. They can help you navigate the murky waters and guide you through clear next steps. So, I hope this small series on the back to basics of who are the RACs has proved to be important. It's fundamental, if you have Medicare as a payer, to stay in the know on all things RAC. Remember, CMS contracts with RACs. Again, they are authorized to review claims on a post-payment basis. It's also important to know that RACs are paid on a contingency basis, which means they receive payments based on the amount of improper payments they identify. And they may also receive payment related to underpayments they will identify. So, as always, I always support the facts that when the documentation paints the medical picture with clarity and vibrancy from the onset of care, a certified medical coder can then abstract codes with accuracy. And finally, in this week's inspiring quote in Spark is from Oprah. My whole reason for creating a network is literally to bring little pieces of light. It's to continue to spread little pieces of light in the world to illuminate the possibility of the human spirit. Amazingly true, right? I think this is a perfect quote that reminds us, inspires us on the significance of illumination. This impactful statement reveals the power of illumination within ourselves. This statement shows us that all of us have the ability to light up the world. Each and every one of us can make an impact on one another. I am happy Oprah's spark still burns brightly in all of us today. So that wraps up today's episode. Please go out and make this a great day, an incredible week for yourselves. Aim a little higher, do a little more, and give back in any way you can in 2021. We just have a few more weeks of it, right? 2021 is almost over. There's so much each one of us can do. Now, in my final note today, it's the same final note as last week because it's a good one. There's very little time left before Santa arrives, so please go out and volunteer your time. Cook that hot meal and serve to those left hungry in your communities. Support your local clothing and shoe charities. Any little bit of giving makes a huge impact. And as always, I appreciate you diving into today with me. If you want more information from me, please go ahead and follow me on LinkedIn. I'll leave links to everything in the show notes below. Please continue staying safe and healthy. Practice safety for one and all during our collective, seemingly never ever ending life and times of coronavirus. Thank you so much for listening in on today's very special episode, and I hope every week with me brings you closer to helping your providers paint a masterpiece. See you next Wednesday.